Hi everyone! Today I'll be discussing the theory of successful aging by Meredith Troutman-Jordan. I chose this nurse theorist because I really believe in the importance of helping older adults enjoy a full life. Many of our patients are in this age group, but often the messages of society and even medicine focus on the negatives of this life stage. By applying this theory, patients can experience a more positive and productive outlook on their future and their health. For my concept map, I'm applying this theory to a patient who's experienced a stroke and now has left-sided weakness. A life-changing event such as this can exacerbate fear of aging and launch the patient into a period of adaptation. Troutman-Jordan referenced Roy's adaptation model and the importance of developing coping skills. Troutman-Jordan focuses on three key areas of physical, mental, and spiritual well-being. And the goal of the nurse is to help the patient move towards successful aging by growing in these three areas. First, let's look at the physical challenges and coping mechanisms for this individual. The patient with left-sided weakness is experiencing a loss of independence due to decreased mobility as well as speech difficulties. Physically, the nurse's role is to help the patient relearn how to safely perform ADLs, such as washing, dressing, and feeding themselves to promote independence. Maintaining safety is very important as the patient adjusts to new physical challenges. Learning how to use assistive devices, transfer safely, and call for assistance are important areas where the nurse must provide teaching to promote patient safety and success. Next, we'll look at the mental and emotional health of the patient. One way the nurse can help the patient grow is by encouraging social activity. This patient may initially be embarrassed or concerned by limitations resulting from the stroke, such as difficulty walking or speaking, and by participating in social activities on the unit, the patient can practice interacting with others and also build confidence with others who may be struggling with similar deficits. Creative outlets such as art, music, and gardening are also very beneficial and therapeutic to explore. And recalling past success is an important tool for the patient to develop in this area. Looking at their current situation may be overwhelming, but recalling a past life struggle and how they overcame it can reveal clues to coping skills that can be useful in recovering from this challenge as well. And for the patient to grow and adapt, creative problem solving will be required in response to the many changes that they are currently experiencing. By investing time in creative outlets and recalling past success, the patient can expand their ability to creatively respond to the challenges they face. Now we will look at the spiritual questions that develop for the older adult. And in this stage, it's important for the nurse to encourage the patient to explore their personal beliefs and practices. The patient may have hard questions and may be struggling with the idea of life and death, which will take on a new meaning at this stage in life and a new importance as they look at their own life or maybe as they've recently lost loved ones. So it is important to give them that space and allow them to ask those difficult questions. Also allowing space for their faith practice, so space for prayer, meditation, journaling, visit from a chaplain, or watching religious services on television, or receiving calls from a spiritual leader in their faith practice. It's important that the nurse helps advocate for the patient to make sure that they are able to comfortably practice their spiritual life within their current setting. It's the nurse's role to assist the patient in all three areas so that they can progress physically, emotionally, and spiritually, guiding the patient toward geotranscendence. This is when the patient is able to incorporate the changes of aging into their worldview in a way that is positive and affirming in the personal, communal, and universal dimensions. When this occurs, the patient develops a more universal perspective with a decreased fear of death and a positive outlook on their current state of life, ultimately culminating in successful aging. Now we're going to look at key components of this theory. In relation to the meta-paradigm of nursing, the nurse's role is to guide the patient towards successful aging. The patient is an adult over the age of 60 that is experiencing physical, emotional, and spiritual challenges related to their life stage. There is some flexibility. There are some sources will use 65 as that starting age for the older adult, but anything in that age range and beyond. The environment focuses on how the patient relates to challenges in their immediate personal location, as well as relationships within the larger community and the universe, as the patient explores concepts of the meaning of life and death and the universal experience of aging. Health is while the patient's physical health status may vary or even decline, the individual can experience a worldview shift that allows them to incorporate the changes of aging in a way that is positive and helpful to the process. Okay, so next we are going to look at successful aging. It's what we keep talking about. What is the exact definition for successful aging? The ultimate goal here is for the individual to find meaning and purpose in their current state of life and to incorporate changes of aging into their worldview in a way that is affirming of who they are as a person and their life stage. And this relies on developing coping skills in 3 foundational areas. And those areas are functional performance mechanisms, where the individual develops skills to manage age-related physical changes and participate in health promotion activities. Intrapsychic factors focus on increasing creativity in overcoming challenges of aging, developing a positive outlook, and accepting personal control. Nursing interventions include encouraging artistic outlook and recalling past success. Spirituality is a connection to a higher being, values, practices, and beliefs about what happens after death. At this stage in life, patients' beliefs may be challenged, as we discussed, and their feelings about life and death take on a deeper meaning. Another important factor that we're looking at here is personal control. This is how the individual views their own abilities and power. Patient beliefs about their own personal control will significantly affect the aging process. A patient with a positive outlook who takes responsibility for the variables that are in their control will be much more successful at developing coping skills. For example, looking at the patient from the concept map, if that patient is participating actively in speech therapy due to personal control and self-motivation, they will progress. Whereas a patient who does not embrace personal control may not actively participate in therapy and may look for excuses and focus on limitations that will hinder their success. Growth in these 3 areas will lead the individual toward geotranscendence and ultimately successful aging. And geotranscendence encompasses a worldview shift in 3 dimensions. The self dimension incorporates appreciation of personal growth and development apart from the physical effects of aging, and self-discovery and greater freedom. The social dimension focuses on an increased sense of connectedness, and also the individual may reevaluate relationships, becoming more selective but also more invested to relationships that are important. And then the cosmic dimension is a feeling of being part of the universe, and the patient at this stage is when they will experience that decreased fear of death. That is an important aspect of successful aging. This theory improves nursing practice because it has important implications for patient success. Many people in our patient population are older adults, and some may more easily maintain a positive outlook, manage their health conditions, and maintain involvement in activities they enjoy and social relationships. But many may struggle to adapt and become overwhelmed, leading to both a decline mentally, spiritually, and physically. By setting clear criteria for successful aging, nurses can study the effects of nursing interventions on helping these patients develop in these three important areas and improve the quality of life for a large segment of our patient population. Here's a list of references I accessed in preparing this presentation. Thank you for taking the time to review my presentation and to consider Troutman-Jordan's theory of successful aging.